Each year in the U.S., more than 4,500 infants die suddenly of no immediate or obvious cause. Half of these sudden deaths are due to SIDS, sudden infant death syndrome.
Next month, a group of local physicians will step up to the plate at the baseball grounds to help kick off Infant Mortality Awareness Month. Dr. Scot Ackerman is one of the First Coast leading doctors and will once again be participating in this great event. He joins us today to talk about infant mortality, along with Don Clark, who is with the Northeast Florida Healthy Start Coalition. Welcome, both of you. How are you doing?
Good. We're doing good, thank you.
Good morning. This is a staggering statistic I saw. In Florida, in Northeast Florida, in 2012, 127 babies died before their first birthday. I didn't realize that infant mortality was such a big issue, especially here.
Well, Florida's infant mortality is amongst the highest in the nation. And part of that is SIDS. It's only one aspect of infant mortality, but SIDS is sudden infant death syndrome. And it's really a big issue here. Not only is Florida's numbers high, but Jacksonville's outcomes are worse than the state average. So SIDS, or sudden infant death syndrome, is defined as a sudden death of an infant that's unexplained, and the infant's less than 1 year of age. And so reducing sudden infant death syndrome is an important public health priority here in Northeast Florida.
And in fact, so important, a new law was just passed.
Right, a new state law goes into effect July 1st, and it requires parents of newborns that they receive safe sleep education before being released from the hospital or a birthing center. And so some of the things that are in this educational program for new parents is to place the child's crib near their bed for the first 6 months so they could hear the child at night and be aware of what's going on in the child's crib. Also, never to place objects in the crib like bumpers and toys that the child could choke on. And there's been controversy over the years whether the baby should be sleeping face down or face up. The consensus now is that it's best to reduce infant mortality if a baby sleeps face up. Also, use tight-fitting sheets so nothing gets bunched up, and wrap blankets tightly around a child, and never let an infant sleep with an adult in the adult bed. That's dangerous. You could roll over and not know that you're smothering the child. So the Healthy Start Coalition is working to bring to do lots of things in Northeast Florida. And one aspect of what they're doing is a safe sleep education to help reduce infant mortality.
And Don, let's bring you into this conversation.
Yeah.
What exactly, what service does Northeast Florida Healthy Start Coalition provide in this way?
We actually have several initiatives that we do. Case management obviously is one. So any pregnant woman in the state of Florida or any infant that is born in the state of Florida, they do a Healthy Start screen at the time of either going into their prenatal appointment doctor or when the baby is born, and based on those risk factors, they can actually be assigned a case manager that helps them with the education that Dr. Ackerman talked about. And then we have some other initiatives that are called Mom Care. Mom Care is a Medicaid program that for pregnant women, if they do not have insurance, the income guidelines are increased slightly, so they may qualify, which will help them once again to get insurance and to go into prenatal care, which is very important.
That's great.
We also have another project that's called the Azalea Project, and that's a substance abusing project for women that are pregnant. Kind of once again gives them the education that they need, hoping to work with the mother while she's pregnant and to make sure that that baby is born drug-free. And then another MAID project, if you notice there's all flowers, is the Magnolia Project. And the Magnolia Project is an interconceptional. They work with women from 15 to 44 as long as they can get pregnant and do some education to make sure that their bodies are healthy for their next pregnancy, because unfortunately they get into the program because there has been a death of infant mortality.
And you have an event coming up that helps fund a lot of these programs.
Yes, and one of our events, because we only get so much money, and so we have to go out and raise a little, we're doing a rounds of the grounds, and we are actually having some doctors. We have 2 teams of First Coast doctors that will be helping with this charity event. And the money that we get from that is actually matched by the Chartrand Foundation. And the Chartrand Foundation matches it dollar for dollar, which is wonderful, yes. And with that, then we will take that activity, or take those dollars to go back into the community for more educational events.
So we got celebrities involved in this, I see.
Dr. Ackerman.
This is not your first year doing it either, is it?
No, I've done it for a number of years. It's a really
Yes.
fun event. I care for adults all year long, and so this is a great way to help kids as well. And I invite my staff and our patients and our family and all our staff's patients and our staff's families and our patients' families. And it's a lot of fun. I really encourage you guys to come out and support the coalition. And we have lots of special guests, a lot of JAG players.
Well, we've got pictures of you participating because, you know, it's such a nice way for you to talk to your patients, not necessarily about a dangerous health issue that they may be facing, but about something fun to come out and to support players in the community.
Right. It's great fun doing that for me.
And the Jaguars, we've got.
So who are some of the other celebrities coming?
Yes, we have.
Besides the biggest one.
Besides the biggest one.
Right.
We have Eugene Monroe. He has actually been a sponsor for us and have hosted for the last 3 years and now the 4th year for us. So that is awesome. We have 2 team captains. They are newer this year, and that's yes, and Isaiah Stombach. And then we also, because the Healthy Start Coalition has been out in the community trying to raise efforts and get the excitement of really understanding what infant mortality is, we also have worked with the Cinderella team of 1996, the Jaguars, and those of you that have lived here long enough understand what the 1996 Cinderella season is. So we have Paul Fraze that's going to be helping us out. We have Mike Hollis. We have Damon Jones.
Also known as the Big Sofa.
Yeah. And we have Todd Fordham. And then we have Tom McManus. And we also, from Channel 12, will have Chris Porter. And he will be the umpire for us.
Nice.
Yeah.
Very cool.
And so how do we get tickets?
How do you get tickets? You go on our website, and you can purchase them from the Northeast Florida Healthy Start Coalition's website. And then the game starts at 5 o'clock, September 1st, which is Labor Day. So if it's too late in the night, you don't have to hopefully go to work the next day because it's Monday. Tickets are $10.50, and it also gets you not only to the celebrity rounds of the grounds, but also to the Suns game.
And you know, it's a great cause. Call in on Monday.
No, Monday's Labor Day.
Monday's Labor Day.
Oh, it is.
Yeah, so it's a Sunday night before Labor Day. It's perfect.
Well, thank you so much, John, and also Dr. Ackerman for sponsoring this segment. For information on Rounds at the Grounds, you can go to nefhealthystart.org.
And one lucky viewer is going to win a pair of tickets to see this event. Just text the word ROUNDS to 25543 by 3 p.m. today, and one winner will be chosen at random.
Get 2 tickets to go.
Yeah, and you don't have to go to work the next day, of course. Come